Hey there, I'm Dr. James Stalkup. I'm the medical director of the Wilma Mankiller Health Center. Y'all have seen me around. Today I'm going to be talking about insulin education. I've been doing patient education for years. Teaching people about diabetes and using insulin is one of my favorite things to do. I always like talking to patients face to face, but this coronavirus has made it very difficult. I've tried educating people outside, I've tried educating them over the phone, over the internet, and what we found is patients don't always remember everything that we say. So to keep us and you safe from COVID-19 and to provide you with education that you can re-watch as many times as you need, we're now doing insulin education by video. You've probably been given a card or a little sheet of paper with this design on it. This is called a QR code, and all you have to do is shine a smartphone at it and click the link to go watch this video. So in this video, we're going to talk about using Levemir or Detamir long-acting insulin. It comes in a pen like this. Now this is a demonstration pen, so the pen that you were given by pharmacy may have a different color label on it. This pen can stay in your refrigerator. When you get a box of these pens from the pharmacy, put them in the fridge. Then, when you're ready to start using them, remove one from your refrigerator, let it come to room temperature, and that pen can stay at room temperature for 42 days. Now, don't leave it on the dashboard of your car in the summertime in the Oklahoma sun, and don't leave it in a place that it could freeze. It needs to be under 86 degrees and it'll last 42 days. So what do I do if I run out before 42 days? Well, I just throw it in the trash and take another one out of the refrigerator. Now remember, you never share this insulin with anyone. Your doctor has prescribed this insulin for you. Insulin is a naturally occurring hormone in the human body, but your doctor has given you a dose and preparation of insulin that is specific to your body, so make sure and don't share. Likewise, we never share a needle because first off, the needles are not supposed to ever be reused, but secondly, it can spread infection to ever share a needle with another person. So Dr. Stalkup, where can I inject insulin? Well, there's a lot of areas that you can inject insulin. You can inject insulin on the outer thigh, you can inject insulin in the fatty part of the arm, but today we're going to focus on the belly, which is the most common area that people inject. Imagine that the fatty part of your belly had a big circle drawn around it, and then you put a plus sign across that circle to divide it into 4 areas. Make sure that you rotate and change the site of injection every time you give yourself insulin. If you don't, if you were to inject insulin in the same spot over and over, it can cause some hardening of the tissues. Also remember that we don't want to inject within 2 inches of the belly button. Imagine that you've got a red circle drawn around your belly button and you're not going to inject in that 2-inch circle. Okay, so step 1 is going to be wash your hands. Always wash your hands before you give yourself a shot of insulin. Step 2 is to attach the needle to your pen, and I'm going to show you how to do that right now. First off, uncap your pen. Needle looks like that right there. Now we're going to open the needle by taking the paper off the top. Then we're going to take the pen and screw it into the needle, and we're going to screw that righty-tighty. You remember hearing that righty-tighty, lefty-loosey? Now, once this is screwed in, we can pull the plastic cap off. There's also another cap. When you pull the first plastic cap off, you will see that there's a smaller one, and then look at that. Look how small that needle is. There's hardly any needle there. The modern technology that they use to make these pens and needles have made it much easier to inject insulin. Also, it hurts less. Now, each shot gets a new needle. We never share a needle with anyone, and we never reuse a needle. Each shot gets a new needle. Step 3 is going to be priming the pen. We have to prime the pen before we use it. So we're going to take this pen, we're going to turn it until it says 2 in the window, and then we're going to hit the button. A little bit of insulin will come out the end, and now you're sure that you don't have any air bubbles. Now, step 4, we're going to select our dose. So you are going to turn this to the dose that your doctor started you out with. It may be 10, it may be 15, it may be 30, but we're going to turn this until we see the number that our doctor told us appear in the window. So step 5 is we're actually going to give the shot of insulin. So we need to make sure that our skin where we're going to give the injection is clean. Some doctors recommend using an alcohol swab for this. Then we're going to pinch the skin and fat tissue between our fingers. We're going to take the needle and insert it directly into the skin, straight down, never at an angle, always straight down. Then we're going to press the button and count to 6. Now, after we've pressed the button and counted to 6, we're going to remove the needle straight up. Now, our final step will be to dispose of the needle, and a lot of patients get confused about this. So we can grasp the needle and unscrew it, and then we can take this needle and put it in a thick plastic container, something like a laundry detergent bottle. Then, once that container is full of these sharp needles, we tape the lid on securely. We got to put tape on it so it can't come open, and then we put it in the trash can. This will keep your sanitation people safe from getting needle sticks. Now we just recap our pen and we are done. Now when we're using insulin, we always watch out for signs of low blood sugar. Signs like headache, confusion, dizziness, sweating, anxiety, irritability. And after your injection, if you have any fast heartbeat, shortness of breath, swelling of your face, your tongue, your throat, or difficulty breathing, make sure and seek emergency health care immediately. So first what we're going to do is we're going to tear the paper off of the top of the needle case. We're then going to carefully screw the pen into the needle, righty-tighty, at which point we're going to remove the protective cover. Now remember, there's one more cover on this needle. We will remove that too. Now it's time to prime the device. So we're going to turn the knob to 2 and hit the button. You'll see a little bit of insulin come out the end. That means there's no more air in it. Now we're ready to give our shot. We're going to turn the dial to 10 units for this example. And then after we have the dial set, we're going to put the needle straight into the skin. We're going to press the button on top of the pen, and we're going to count to 6. Once this is done, we're going to remove the pen from the skin. Now we're going to unscrew the needle and put it into our sharps container. That concludes our video on how to give yourself a shot of Levemir long-acting insulin from a FlexTouch pen. Thanks for watching.